Hi, Dr. Tam here. We had a patient today ask me about neuropathy because she thinks her mom has neuropathy, and all the doctors did was really just give the mom medication. They gave her gabapentin, Lyrica, they gave her other sleeping medications, and of course, when you are going to sleep, when the medications maybe turn you into more of a zombie-like person, some of the side effects, it can have that effect. You get forgetful, you get really tired and fatigued, and they even say on some of the medications not to operate heavy machinery. Well, that means you can't drive, right? Who wants to be in pain and not be able to drive, or take a medication and not be able to drive? So I went on explaining to her that neuropathy really, and I want to explain the same thing to you, although it's happening in the nerves and they do diagnose it as nerve pain, usually it will start in the fingertips or your toes. Really what it is, it's a circulation problem. My patient was really shocked to hear that it was a circulation problem. And what I told her was, it's the inflammation and the toxins in the blood that cause the dying of blood vessels. And these blood vessels around your nerves are so small. That's why they call it peripheral neuropathy, because it's at the edge, it's at the fingertips, it's at the toes. And it's of course going to affect the nerves and the blood vessels that's furthest away from your heart, which is once again your toes and your fingertips. So hopefully she's able to go home, explain it to her mom, and I believe next week she's going to schedule her mom in for a consultation in our office. We have lots of patients that we have helped over the years with their neuropathy pain. And if you are sitting at home watching this video, and if you are suffering from neuropathy, make sure you give our office a call and maybe we can help. We're going to go over with you, number one, do you even have neuropathy? Maybe you're not even sure. You just have tingling, burning sensations in your hands and you're sensitive to the touch and maybe it's numbing. Do you have neuropathy? That is the key thing, because if you're taking medications or if you're doing things that is supposed to cure it or help with the pain, and there's a lot of side effects with medications. If you're doing that and you don't even have neuropathy, well, that's a problem, isn't it? Well, number one, we're going to tell you, number one, do you have neuropathy? Number two, if you have neuropathy, what's really causing your neuropathy? Because if you're not correcting the cause of the problem, well, now the problem will just get worse. It's like a snowball effect, right? And number three, which is the most important, can we help with your neuropathy pain? Okay? Give us a call. Maybe we can help.